Jeff here with you again today. It's February, it's Heart and Stroke Month here in the clinic, and I thought I'd talk to you a little bit today about heart and stroke and heart disease. Before we even start talking about the cause of that, we think we need to go way back to talk about triglycerides and cholesterol. Triglycerides and cholesterol are actually essential nutrients that the cell membranes are made of, and cells need to repair themselves. So it's very important that you have triglycerides and cholesterol in your diet. But what happens in the liver is the liver actually produces something called VLDLs, or very low density lipoproteins, and LDLs, which are called low density lipoproteins. VLDLs are more triglycerides, and LDLs are more cholesterol. But the liver produces these, and it gets into your bloodstream, and it kind of bounces along through the arteries, getting to the cells to be used. What can happen as it bounces through the arteries, little pieces can break off, and these lipids will then attach themselves to the sides of your arteries. And this is called plaque, and this can kind of build up over time. And if it gets built up too much, what can happen is you get something called hardening of the arteries, or arteriosclerosis, and the area gets thinner and thinner and thinner. What happens after that is that the body produces something called HDL, or high-density lipoproteins. Well, these are we call your good lipoproteins, because they're like the garbage man. They come in and they follow up after the VLDLs and the LDLs get through your system. They kind of pick all this plaque up and take it back to the liver to get reprocessed for later. But what can happen is once things get into your heart, because around your heart you have arteries that supply the heart with blood. So one of these is called the left anterior descending artery. We have the left circumflex branch, left anterior descending branch. All these arteries supply the heart with blood. And what can happen is that over time, this plaque can build up inside those arteries, and they'll get smaller and smaller and smaller. As you can see in the cross-section here of the coronary arteries, you can see that on the left, you'll see the normal condition of the artery is nice and big. There's lots of room for the blood to flow. And as you get further to the right, it gets smaller and smaller and smaller. And by the time it gets to the end, you can see it's a very small hole for this blood to flow through. And a couple things can happen. One is a little piece of that will break off and get into the heart. And that can cause a heart attack, or it just completely shuts down. Sometimes before this happens, you may get something like an angina attack, where you're feeling a bit of a tightness in your chest, but you kind of think it's nothing to worry about. But it finally gets closed, and that's when you get a major heart attack. So wherever that artery is going will actually then not receive any blood, and it actually dies. So the job of the HDL lipoprotein then is to go around and try and clean all this up. So it's very important that you have a very high ratio of HDL. You should have about a 5-to-1 ratio of your VLDLs to your HDLs in your body. Your doctor will do some blood work to try and find out what ratio is. If the ratio is much higher than that, you are much higher risk of having a heart attack or a stroke. For a stroke, what happens with a stroke is now we have to talk about the coronary or the carotid arteries. At your head and neck, you have the carotid arteries, which are the major arteries that go up through your neck to get into your head and your brain. And they supply a lot of blood to your brain. And the same thing can happen that happens in your coronary arteries happens in carotid arteries, where that cross section we looked at gets smaller and smaller and smaller. And again, what can happen is a little piece might break off, and as it flows up, as you can see by the areoles, it flows up, and you can see the plaque being pinched there on the right hand side. A piece of that will break off and go up into your brain, and that will actually cause a stroke. It's important that you visit your doctor and get some blood tests done to measure your levels of your triglycerides and your cholesterol, and especially your VLDL, LDL, and your HDL ratios, because that will give you an idea of whether you're at risk of having a heart attack or not. So next week we'll be talking a little bit about how can I improve my HDL and my LDL and VLDL ratios. So I'm Dr. Jeff. If you like this video, share it with your friends. If you have any questions, you can always email me at jgoldsworthy@goldsworthywellness.com, and I've got your back.